All right, so here is the respiratory system, cardiovascular system. I went in and cleaned up a couple things before I get rid of them, just to show you. Here is diaphragm muscle. Okay, so again, you can see the striations on it, because again, it is kind of a hybrid muscle, if you will, if you think about it, because again, it is under voluntary control because you can stop it, but it's also not, because it's part of the automatic responses of the body. And then here is the gallbladder with a section of the liver that I held onto just to show that material. Let's see if I can get a little of it here on a paper towel without getting it everywhere. We'll see if I can get some of that out of it. Oh, and yep, it squirted. You wouldn't see that on TV. I just squirted it on the underside of the iPad. So we squirted down in this direction. There we go. So again, you can see that bile has a green texture to it, okay? And so does the bottom of the iPad now. So I have to get that cleaned up later. All right, and then in the abdominal cavity, we have two kidneys here, and with the two kidneys, this is one of the ureters. This is going to lead down to the bladder down here. So this is, if you've had anybody you know or yourself dealt with kidney stones, kidney stone pain is when that little rock, which is what it is, goes down this tube into the bladder. The pain is not from it being in the bladder, it just kind of rolls around. But the rock itself, the material is coarse or jagged edged. So when it goes down through here, it causes immense pain. I would know, I've had kidney stones for about the last 20 years. So it goes down through here. Luckily, I haven't had a kidney stone attack, if you will, in what is probably about 10 years now. Just changed a lot of things that I do. But that would be there. And you can see here in blue is going to be any of the venous material. Pinkish color or clear color almost is going to be any of the arterial. So this is where the liver was. It's gone. So right here is what would be the human equivalent of the inferior vena cava. Okay, here in blue, okay, that is going to be going through from kidneys for filtration, liver, and then back up to the heart. Okay, so now what we're going to do is move into the chest cavity. I got to open that up and move that out of the way. I've removed a lot of the diaphragm. Okay, so what we want to do is open that up, and then you can see there, okay, you have the lungs with the multiple lobes and the heart surrounded with this pericardial sac. So with this, what you have is you have what's called an accessory lung down here. So this is a little lung, okay, down here, just an extra piece. Okay, this is the accessory. Okay, and then you have the posterior lungs because they're towards the back. Okay, you have the medial lungs, which are in the middle, and then you have the anterior lungs. So anterior lungs, medial, posterior, and accessory. So you have 3 lobes on that side, 3 lobes on that side, and an extra lobe here. So the cat technically has, or not technically, has 7 lobes to its lungs. Okay, so again, an anterior portion, a medial portion, and a posterior portion of the lungs of the cat. So if I just go into that diagram, this would have been on your final. You would have seen this diagram where you had to identify the different lobes of the lungs. Okay. Now, another part that we didn't get to earlier, because it was up here, is the trachea / esophagus. So up here in the neck, if I start to work around, I want to be careful up here in the neck, because I want to be able to preserve the arteries and veins that run up and down, because that's part of the thing we want to do, which is trace the path of blood to the head. But if I start to tease these away, I can see here this rib structure. And if you remember, when we did this with the heart dissection, and we took the sheet pluck that included it, we had the trachea, which was very tough. So what we have here in the neck, this is the trachea, okay, and it's what would happen. This is a texture thing, okay. You would have been able to feel how ribbed it is, like a garden hose, okay, and it's very tough. And next to it here, this is the esophagus, okay. So when we say the wrong pipe, they're next to each other, and in the mouth, in the human, you have covering, okay, that flips over top of it and covers the trachea or the windpipe, when you swallow, which is why when you talk with your mouth full, you run the chance of blocking that trachea, the airflow down to the lungs, because fluid or food may block that opening because it's up. Okay, so again, what happens is you can imagine it closes shut when you're swallowing. When you're talking, air is going out, so it's up. So you allow that opening if you're trying to talk, and food could go on the other side of that. So again, we have the esophagus and the trachea here, and again, you can see here in red. Okay, these will be going up to the head. Okay, when we look at this, and I'll show you that group here in a minute, and we'll find the blue in there as well. So again, when we look at this, we have the accessory. We have the accessory down here, posterior, medial, and the anterior lobes. If we pull these out of the way, we can start to see the bronchial intersections, which is where the trachea will intersect with the lungs. It's very hard to see on the camera because the heart is blocking it. So what we're actually going to do is I'm going to take the lobes of the lungs, and I'm actually going to cut out an entire section. My fan just cut off. So here we go. Here's 3 pieces of the lung, okay, the anterior, medial, and posterior, cut out. And right here, you can see there's pink for the arterial blood that's going to be in there. And then and there's some blue for the venous blood, okay, or in this case, the arterial blood would be the blue because it's going to the lungs, and the venous blood here in the pulmonary circuit. But with that, if you were able to be here to feel it, you'd feel some coarse material, which is where the trachea was, okay, as it intersected. So there's my esophagus running down. The trachea's intersection with the lungs, which is hard to do and look at with all the pericardium and parietal material here. So again, I'm going to pull the lungs here and try to clip this so I can take the whole section of the lungs out together. Now, I missed that one. I missed the cut and left the anterior portion attached. So again, same kind of thing on those. And again, if I were to roll out of the way, get my hands out of the way, again, always forgetting that I'm on TV. You've got that here. So there is the superior vena cava right here coming into the heart. Okay. Now with this, in the visceral and parietal pleura, okay, the coverings, okay, the lungs are shiny, okay, and similar to what we had with the brain and the direct pia mater and with the heart, okay, you have a direct coating on top, okay, and that is that visceral, okay, pleura, which is directly covering the outside of the lungs. The parietal pleura, okay, is more along the linings of the ribs here. Okay, you can see how shiny that is. And that is a place, that pleura there is often a place where lung cancer is developed and seen. Okay, so you can see this connective tissue here. So with that, one of the things that was concerning for my father was the fact that when they gave the test results, his parietal pleura was littered with abnormalities. So on the CT, so that was what led to understanding eventually that he had lung cancer and that it was mesothelioma from his years of working in the auto industry and the mines. So by the time that was discovered, it was far too late. But that's where that would be seen, is in this lining of the ribs is often a place where you'll start to see that. You might go, wait a minute, the lining of the ribs showing lung cancer. Yeah, because again, this is the coating that covers around the outside, protecting the lungs. You'll often see it'll move into the muscles or the bones of the ribs to be able to grow. So one of the things we're going to do here as we look at this, I'm getting close on my max time I typically try and do, so we'll come back with the heart. So again, that was the respiratory system.